everybody. I am so excited for our virtual roundtable. It's October, it's ADHD Awareness Month. And for those of you who've been following along, you know that we have had a wonderful time getting to know these lovely guests who are here tonight, sharing their story about living with ADHD, doing the work that they're doing. And we're hoping that this broadcast will inspire you. I'm Dr. Narissa Bauer. I'm a behavioral pediatrician, CEO of Let's Talk Kids Health, and creator of Teach Me ADHD. I used to love doing these virtual roundtables, and I haven't done one in a while. So I thought October month would be a great excuse to get some wonderful people together. So while you're here and you're following along on YouTube and Facebook, please make sure you know that you can ask questions at any time by entering a comment in whatever platform you're watching, and we will be monitoring those for questions or comments that arise. We want to make this as interactive as possible. Before we begin, I'm going to go ahead and ask my guests to give a quick introduction of who they are, and then we'll get right into it. Okay, I'm going to call on Dana, since you're right next to me. If you can please introduce yourself.
Sure. Hi, I'm Dana Cruz. I'm a certified ADHD service provider and ADHD coach. I have 20 years of experience as a behavioral health specialist and social worker. I've been a practitioner of contemplative practices such as yoga and meditation for over 25 years. I specialize in the integration of stress management and emotional regulation into evidence-based ADHD care by supporting adults, college students, and their families in navigating the complexities of ADHD.
Oh, I'm so excited to have you on, Dana. Thank you so much.
Thank you for having me.
Hello, I'm Karen Montgomery, and I'm a mental health therapist. I have a private practice, and I'm also an author and a speaker and trainer who just is incredibly passionate about wonderful humans and learning to understand how our brains work.
I am so glad to have you here again. Thank you. Dr. Jenny Byrne, I'm going to have you go next.
Hey, everybody. I'm a psychiatrist and a neuroscientist by training, and my PhD was actually in attention. So I've been thinking about this for a long time. I still practice. I have a small group of patients, typically professionals, a lot of ADHD amongst professionals. But most of my time I spend advising early stage companies and healthcare, some of which are ADHD specific and some are not.
Great. I am so excited to have you on. I'm seeing that people are hopping on this live stream. Please do leave us a comment. Tell us where you're calling in from, and we will be happy to always answer any questions as they arise. I'm going to have Diane go ahead and introduce yourself.
Hey, new friends. I'm Diane Wingert. I am a licensed clinical social worker turned business coach. I am a serial business owner and just decided after 20 years of being a therapist and raising 3 kids I lovingly passed my ADHD onto, that I was going to start with business owners instead. And as it turns out, it seems like I'm still doing quite a bit of psychotherapy. So I love helping people with big ideas and busy brains bring their creative out-of-the-box thinking into the world. And it's an exciting privilege to be able to partner with them. I also am the host of a popular podcast called ADHD-ish.
Yes, and you must go listen and subscribe. So thank you, Diane, for being here. And our last guest, and last but not least, Dr. Diana, please. Hello.
Hi, hello everybody. I'm Dr. Diana Mercado Marmarash. I'm a family medicine physician. I am in Texas. I am still practicing full time. At one point, I was doing nursing home, hospital, and clinic. Right now, I'm just doing clinic and a weekend and a month in the hospital. But I'm also an ADHD life coach for healthcare professionals. I have a 12-week CME course for physicians who have ADHD. So that's an amazing thing that I have been doing for the last 3 years. And it's been amazing to see other professionals embrace their gifts and learn to unwrap them, because if you don't learn to unwrap them, they can easily explode. And everybody can be very frustrated with our tardiness sometimes, or chronic procrastination. But when we set up our systems that support us, everybody's so impressed of how well we all can flourish. So that's what I'm here for today. I am a mom of a 6-year-old and a 7-year-old who definitely keep me on my toes. And yeah, I'm happy to be here.
Oh, we're so glad to have you back. Thank you, Diana, for coming. So we have a hello from San Antonio. Just shout out, thank you for being here. Okay, so I thought that we would get started. And because this specific month we have been focusing on our Teach to Go podcast, your stories about living with ADHD, as all of you are women, professionals, working with families or clients with ADHD, I'd love to hear from you as to when you were diagnosed with ADHD, if you have it, and how it's impacted your life. For instance, I just found out 3 years ago at the age of 47 that I had ADHD. And sometimes people are like, what do you mean? Didn't you know? This is what you do. You work with kids, you work with families who have ADHD. And I will say that sometimes it really took me leaving academia and realizing that all those systems that were in place, the meetings, the structure, I needed that. And I didn't realize that until I left. And so that was kind of what started my journey, as well as just kind of realizing that something was amiss and always feeling like I was not able to keep up with what my brain wanted to do, and realizing I don't know what's happening. Like I have all these ideas and I'm having a hard time getting started, hard time finishing, can't find my keys, can't get out of the house on time. You know the story. So I'd love to hear from those of you here. And then again, those of you watching, feel free, like tell us when you were diagnosed, or if you haven't been or are curious about this, ask questions, because we have this great panel here to help. Okay, who wants to go first? Anybody?
I'm going to go. I'm the elder statesman here. I like to say
Yes.
I've had ADHD longer than anyone else in the room. So I'm going to push myself out in front. And it's kind of cringy in a way, because my oldest child was diagnosed when he was 8 years old. And I knew, even though I was a first time mother, that his development, I'm pretty sure this isn't what other mothers are going through. So he got identified pretty early because he is the quintessential hyperactive, impulsive kid. My daughter wasn't diagnosed until she was in her second college degree. And I was actually the last one in the family to get diagnosed, and that was only 8 years ago. And it wasn't until, like Dr. Bauer said, when I started working full time from home. I was no longer going to an office. I no longer had people aware of my comings and goings. I didn't have the structure, systems, support, and accountability. And that was when things really started falling apart. But I have to say there was a precursor to that too, and that was menopause. And I'm sure someone else will speak to that as well, because that's when I would say that the ADHD party really got started in earnest. I was always struggling, but I had so much energy and was so driven that I was able to keep pushing myself past my struggles and obstacles until menopause, and then until self-employment. So I finally thought, okay. And then I heard from two different people when I finally got diagnosed. One of them said, "Are you sure?" And the other one said, "Obviously." So there's a lot of still confusion and misunderstandings out there, even amongst our own tribe.
Yes. Wow. Thank you so much. How many of you resonate with that? For those of you viewing this at their homes, the speakers. Yeah. Karen, I'm going to invite you.
Yes. So I actually have a story where I was diagnosed way earlier, but it was an interesting journey. I grew up thinking, I'm just not very good at school, but I'm really kind and I'm good at a lot of things. And there's a lot that I like about myself, but school's not one of them. And I went to college, and luckily I found my abnormal psychology class. And the minute the teacher started describing ADHD, I was like, wait a minute, this is me. And everything clicked. And I went from literally taking notes for an hour and if someone said, what did you talk about? I'd be like, I don't know, to a 4.0. And I never dreamed that I would have a career, but I found my passion. And I also have 3 kiddos, and all 3 of them have ADHD. And the girls and the boys are very different. And my husband does too. So we're just one really interesting family, and we have a lot of fun. And it's just been a journey and a blessing.
Yeah, that's not uncommon, right? I mean, so many of us know that ADHD runs in families. And I love the words that you use to describe that, Karen. It makes life fun and interesting because, there's so much stigma around ADHD. And actually, I was talking to an earlier guest when I was recording a podcast episode about the fact we were talking about adult ADHD and how there's not real clear guidelines for adult ADHD, for diabetes, for asthma care, for blood pressure management, there is, but for ADHD, there isn't. And he shared this story about how one of his clients, got the diagnosis at age 60 and was wondering, well, what's the benefit of actually getting the diagnosis and taking action? So if anybody wants to comment on that, also, because that story, yes.
Yeah, I'll jump in because this is so full disclosure, I do not have ADHD. I have a kiddo that is like neurodivergent, not clear-cut ADHD. So I'm still learning. But my practice, I would see a lot of these folks, and then I would hear from other physicians, which was very discouraging. These comments like, well, if you're not in school, you don't need to be treated for ADHD. Or like, well, you're over whatever age, 60, 50, whatever, so you don't need it. It's only there to get good grades in school. And that really bothered me because a lot of the dysfunction or difficulties that I see come to me actually have more to do with relationships than school or work. A lot of the adult professionals, and Dr. Diana sees physicians, I saw a lot of physicians too, they're actually pretty successful, maybe with a lot of effort, more effort than they had to put in or whatever, but they got there. But it was really their relationships with a non-ADHD spouse where things were falling apart, and a lot of people on the verge of divorce by the time they got to me. So it's really like a lot more about the relationship sometimes than their ability to do well at work. And I always thought that was really sad that people would think of it that way. It's only something that matters if you go to school, because it's so much more than that, right?
Much more. And as someone who is married to someone that actually has ADHD, I think there's this shared understanding, yet every presentation is so different, particularly with males and females and really everyone. And so I think there are even challenges when you do get the ADHD brain, you still have to learn that person's particular ADHD brain.
That is so
and I think
true.
the terminology is just, well, I don't know, my point of view, I don't know about you all, but like the terminology doesn't make any sense. It's not that you can't pay attention. It's that you can't modulate it perhaps the way you want to in certain circumstances. And it's not a disorder. If 5% of the population has it as an adult, that's a variant. Yes. And there's probably a lot of good evolutionary reasons that we have brain variants and we don't all have the same brain, right? So the title is quite unfortunate. I think that's a lot of the stigma too.
Absolutely.
I have a very similar experience with Dr. Bauer, working in the field in behavioral health, in social work, working with a certain population, with certain multiple situations in which they were facing economic hardship, educational hardship. And so I always thought ADHD looked like a certain thing, and never did I ever think that it was part of who I was. I had a learning disability as a child. That's what I was diagnosed with. And so I always just didn't do school well, or I wasn't smart enough, or I was good at other things. I was a creative, or I was kind, or and not having an ADHD diagnosis until age 40. That was 4 years ago. So definitely it started feeling like something was changing at 40, maybe premenopause, possible other, life situations. It just felt like there was something different all of a sudden, and starting to transition into a different career, and then COVID, and everything was turning kind of upside down in terms of, I wasn't out in the public or out at schools, or constantly moving and meeting people and going places, and so everything just felt different. And so going into the coaching realm, into the private sector, learning so much more about ADHD. Wait, this fits. Wait a minute, this fits. Wait, this, oh, I totally identify with that. And working with clients already having maybe established some strategies or procedures myself, or utilizing tools myself, and sharing those with clients just made me even more so like, oh, wow, like, yes, this is ADHD. This is a part of it. And learning the complexities of it and learning the neuroscience of it, or just that whole new lens. Like, you see your entire life with this entirely new perspective. It was quite amazing for me. Yeah.
I can share my story next. So I got diagnosed when I was 23. I was in my first year of medical school. I had, one of those neuropsych tests that are like 8-10 hours long. At that point, they were trying to figure out whether I was just having test anxiety, like, because I wasn't completing my test, like, but then, I would probably get 2/3 out of the way, and then after that, everything was C all the way down, because I would run out of time, or I would be second guessing myself, because I didn't think it would be that simple, and then you would get stuck on one thing and overthink it. And anyways, when I got the diagnosis, I didn't even know what that was. But I thought, oh my God, they can't know I have it, because then all I have is me being smart. And if I'm not smart, then what am I? Like, that's what my brain kept telling me. So I didn't tell anybody other than like 2 or 3 and people and my mom. And then they gave me meds, but again, they didn't teach me to ask for a dose adjustment, or to talk to a therapist, or to talk to a coach, or like, usually, like Dr. Bauer was saying, when you have diabetes, high blood pressure, something else, they don't tell you take meds and go away. Like, they give you all the other strategies, like exercise, and this is the diet, and blah, 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 right? And I felt like when I got this diagnosis, I didn't get all the other things that I wish I would have gotten. And after I complete my training and I become an attending, which is somebody who has graduated from medical school and has graduated from residency, they tell me, well, you just need to stop coming to the student health, because you're not a student anymore. You need to have your own physician, which makes sense. But at that time, when I sought an attending physician or a psychiatrist, I got told that I should know better, that as an adult, you outgrow ADHD. And so there went 10 years of me neglecting my own ADHD and working 30, 40 hours outside of work to try to compensate for trying to close the notes, because it was a love-hate relationship. I love my patients. And of course, I could talk to them for 45 minutes and it felt like 5 minutes. And it was too boring to write a note. So then you could see why, it was taking me that long. And I was too embarrassed to tell everybody else how much I was working outside of work, because I didn't want to be labeled as a bad doctor. COVID happened, and you couldn't continue to ignore your ADHD anymore, because the systems that you had in place couldn't continue to happen, because, well, you had limited resources and you didn't want to get other people sick. In some instances, some physicians saw less patients, but being primary care, you were frontline and you never stopped seeing the patients. So I had to stop ignoring my ADHD diagnosis, and I found coaching, and I found life coaching. And then I was like, I wonder if there's ADHD coaching. And then there was. And then I was like, maybe I should start using all those resources. And I went back to meds, months. And then I started therapy, and the rest is history. And here I am helping other people. So I think we have to remember that, there's a lot of resources out there, and you don't know what's going to work with somebody, and you just have to keep an open mind and keep asking for a second or third opinion until something feels like it lands.
Yes.
Yeah.
It's almost reverse imposter syndrome. Like they would find out that you weren't as smart versus, oh gosh, I'm not smart enough. It's just that I think that female component where we really everything is internalized, and it's that negative self-talk and really these roles that are placed on us that this is how we're supposed to be and supposed to act. I think you just spoke to that beautifully.
Yeah, let's talk about that. And again, for those of you watching, as you're listening to this conversation, don't be shy. Please leave a comment. Tell us that you're here, where you're watching from. We'd love to give you a shout out. But this is going to be interactive. So if you have questions, comments that come up as a result of our discussion, please leave it in the comment box and we will definitely address it. So I'm curious. So we've all shared our story. And I'm wondering if anybody watching this is thinking, okay, I wonder if I have it. We talked about how ADHD runs in families. I'm curious from everybody's standpoint, what do you see as barriers to women or adults taking action if they have concerns? I mean, we talked about stigma briefly, the feeling like, gosh, you should just kind of handle it all. Anything else that has come up for you yourself or people that you've interacted with, given your experience?
I think everybody here on this call, all the experts here on this call, are evidence of what I call hiding in plain sight. And that is that people still, I shared in a previous conversation with Dr. Bauer that I was at UCLA doing my master's in social work in the early 90s. And I was told at that time that we know for a fact that ADHD only affects a small percentage of little boys and that 100% of them outgrow it by adulthood. Well, I started meeting their dads. And I said, excuse me, I know I'm just a lowly grad student, but I don't think so. And that's actually what I did my thesis on. And my conclusion was in 1995, we don't outgrow this, but we were still years away from looking for it in girls and women. So what's most frustrating to me is to hear even now that women are being told that, oh, you can't have this because you're too smart, or you can't have this because if you had it, they would have found out a lot. In other words, you're doing so well in life that you couldn't possibly have this developmental condition. Well, I think we did well in spite of it. And who knows how much better we might have done had we known sooner. And so I think it's that if you're being compared to averages, maybe our potential is well above average, but you can't find what you're not looking for. And we still aren't looking for it. And then the other thing is being told, oh, it's either a disability or superpower. Well, I think that's really a broad brush. I think there's so much nuance and every person's case is different. So I just think there's still, even though so many more people are talking about ADHD, especially if you're on TikTok, they're not necessarily all talking about it in a way that's helpful or sheds light and helps more people who actually need help to find it. It's really frustrating.
Yes. And as you become an adult, your needs change, and the pressures that you face and the number of tasks that you face can often increase. And I have noticed that as a mom, that I have to be even more organized than when it was just me. I wake up early. That's part of my regimen in order to have a successful house that's happy and not screaming at each other as we're walking out the door. Those needs change, and what works changes.
Absolutely. And there's this sort of overcompensation and this caretaker aspect of the, cultural expectations or gender expectations. And, we tend to mask, right? And it's like, oh no, we can just work harder or do more or and sort of, get into this Also, I think the other point I wanted to touch on real quick was the, clinicians not believing us. Also, like
Yes.
doctors and clinicians not believing us, and we're struggling, and it's just anxiety, or it's just depression, or it's whatever, it's just this. It's not ADHD, or it's a learning disability. It's not ADHD, and so. If we had emotional regulation as a part of the diagnostic criteria, so many more little girls and women would be able to be diagnosed.
I see a lot of that as well in teachers, and God knows teachers do everything and are phenomenal, but they don't know. And I found that I really had to educate them about my daughter. They thought, well, there's no way that this is the case. And I showed them she's in the 99th percentile. And they said, but she's doing so well. And I said, because she knows how to please you. She knows how to mask. She knows how to change the subject. She's really great at that, but she's coming home feeling really bad about herself. And it was wonderful watching how much it helped to be an advocate. That then the teachers were like, oh, I think this child and this child, they really didn't know. And so I think advocacy is the most important thing, because people just don't know what females or what adults look like with ADHD, unless you're bouncing off the walls. They kind of go, what is this? And so we really have to advocate and give the information to everyone around us.
Yes, I think, Jeannie, you were going to say something.
Yeah, I was just going to say, in addition to all of this, the reality is, in terms of barriers, that the ecosystem, the healthcare ecosystem, some of the barriers are coming from the system, right? So first of all, clinicians are not trained in ADHD. Even a psychiatrist, I did not get trained in ADHD. All my learning was on my own because I was interested in it. So first of all, we don't get trained. And as you all know, clinicians these days, are pretty burnt out or have moral injury, and they're very fearful. And so they're really reluctant to take risks, I think, and they get in a very closed mindset. And so they're not in a great place to listen when you're coming in. And then the reality is that stimulants are still one of the primary ways to treat ADHD, and the amount of stigma around stimulants is just off the charts, and it's not getting better. And the DEA continues to police it. And so it's created this whole systemic stigma. And so I think a lot of it, people will say you don't have ADHD or they don't want to listen, but in the back of their mind or in their subconscious mind, it's because they're afraid that they don't know how to treat it, and they're afraid of stimulants, and they don't want to deal with it, even if it's not at a conscious level. And so a lot of it has to do with the whole ecosystem surrounding this. That's what I see quite a bit.
Yeah.
Or even if they do diagnosis, you can send the prescription, but there might not be anything for you to fill because there's a shortage, right? Yes. And then you have the patient calling around to the different pharmacies, and then how does it look? It looks like the patient is being a drug seeker or whatever, right?
And
so
as
you
a
get
doctor,
all kinds of red flags, or they forget to go finally pick it up, and then by the time they do pick it up, it's out of the window, the 7-day window that the prescription was meant to be filled, and then that causes all kinds of stuff, right? So there's lots of barriers, and like you said, sometimes females are not diagnosed until the birth of their first child, or when they get to college, or they get to law school, or some higher education that requires them to really dabble down on those executive functions that they didn't realize they needed, and they needed a structure, right? And when we get to college, sometimes you don't have that structure that you had in high school, that you had your parents reminding you of different things. Or when they get to menopause, as some of y'all have already said, with the change in the estrogen, that's a great number. Or when they finally see their teenager getting the diagnosis and they're asking all those questions, they're like, oh, I have that too, right? And to the question earlier is well, what does it matter at 60? Well, I hope you're like my grandma who lives into the 80s, 90s, right? And you still have hopefully another 20, 30 years to do all those wonderful things that you wanted to do, if you ever had enough concentration to do. So why not then start writing that book, doing that art class, going for a walk, or just being more active and hopefully delaying that Alzheimer's that can eventually happen to all of us if we get to that age, right? So I think at any age we should treat. And yes, stimulants are evidence-based first line, but you have to complement it with everything else, because as we all know, just because you put on the glasses, if you had surgery because you couldn't see, it doesn't mean you automatically are going to be able to name what you're seeing. So you need to still be able to um, get the help to understand that, okay, now I have this tool that's going to help me to do the things I didn't want to, but how do I still do the things I didn't want to, right?
Yes, thank you so much. So I'm going to pause this here because we are getting some questions from our audience. So I do want to make sure that we answer them. So I'm going to go ahead and show the first one, and anyone here can chime in. So this one comes from Amy. Thank you so much, women's health practitioner here. So lots of discussion surrounding mental fog, mood, concentration amidst the hormonal changes of perimenopause. Any great surveys, resources, testing materials to screen women who still struggle despite introduction and modification of hormone replacement therapy, or HRT? I'll leave that question up there.
I can jump in on this one. This is a lot of what I do day to day. So, first of all, it's great that you brought up like introducing and modifying HRT in a woman, any or male really for that matter. I would say over the age of like 35 or 40, you really should do a full medical screen just to make sure that some of the attention issues are not accounted for by like a thyroid problem. So it's great to make sure you have the HRT available, but also like the full medical workup just to make sure you're not missing anything. Because some people come to me and they haven't had any of that stuff checked in like 10 years. So I always recommend that first. And then when it comes to teasing out like some of the nuance, I really like, I know Dr. Narissa uses this too. I really like objective computer testing for attention. You can do the neuropsych, which is the big long, like you said, 8 hour, 10 hour. And that's really nuanced if you have learning differences. I really like that one for learning differences. But if you really think it's just straight attention, I think the computer tests are pretty good. They take 20 minutes. You can do them at home now. It's not a diagnostic, so it doesn't say yes or no 100%, but it's really helpful. And then I like to use a longer questionnaire that looks at executive function. So it's not so much a screen, but I like to use what's called the Barkley, and I have the person do it and then somebody close to them do it. So that's my workup as a psychiatrist. I like to get a medical workup, do a computer test, do an expanded questionnaire, and then I do a standard psychiatric history to see, because a lot of people, if you're not diagnosed into adulthood, you will have anxiety or depression or substances. That kind of comes along. And so I always want to tease that apart, especially if you're not sleeping. A lot of women in menopause aren't sleeping, and disrupted sleep can really wreak havoc on your cognition. So it's like you want to check out all those things, and then I like to start teasing them apart.
Mm-hmm. Anybody else want to add anything else to that?
Yeah, you got to make sure you check vitamin D, thyroid, like she said. Make sure you check anemia, because if vitamin D, and of course estrogen, like we just talked about. But yeah, you need to make sure that when we arrive at ADHD, we have already screened for anxiety, depression, and ADHD. Anytime anybody comes for any of those, I give them all three. And even when they're coming for diabetes, I still give them all three, because many times we don't realize that they're compensating that their diabetes is because they're having the sugar to be able to concentrate. So it could be something else that's going on. So you just gotta tease it all out. Yeah.
And I think that really speaks to why does it matter to treat when we're older? So many people come up with coping skills that may not be the best for them in order to sustain attention, whether it be that Diet Coke or whatever it is.
Or smoking or drinking.
Yes. And with women, we are often misdiagnosed with anxiety, depression, borderline personality, bipolar, you name it. And it might not be the root cause.
Yes. Yeah. So we're talking about a comprehensive evaluation by someone who specializes or understands ADHD. We were just talking about how even within our own community, there's still so much to learn. And so if it's not something that you see a lot of, it will improve the accurate diagnosis of ADHD if you go to someone who's knowledgeable, and then pairing that with objective testing, and then looking at the whole person, because there's so many other issues that are happening. Okay. There's another question here from Molly, and I'll go ahead and read it. So first of all, Molly, I do want to say that I am glad that you're thinking about coaching and counseling. I would love to get somebody to talk about the difference between that first, and then we can talk about, this is a very specific question, but anybody want to give their idea about this so that we can make sure we're talking about the same thing first?
I suppose I should take this one because I was a therapist for 25 years before becoming a coach. I think at the present time, I think there's quite a bit of overlap. I think there's a lot of coaches who are doing what I would personally perceive as therapy. And there are a lot of therapists who are integrating coaching techniques into their practice. Both approaches are valid, and at different times, and possibly if you have the resources at the same time, you would benefit from both. We have to kind of paint with a little bit of a broad brush here because we don't know the specific individual circumstances, but generally speaking, seeing a therapist is focused on learning skills to feel better and function better. And it can be short-term, long-term, doesn't involve the past. A lot of people like to say, oh, coaching is about the future and therapy is about the past. That's way too general. But what my standards are, if I screen people before I work with them as a coach, and the things that I want to screen out for, because even though I am a therapist, I am no longer practicing as one. If there is abuse, if there is unresolved trauma, if there is active addiction, if there is a current loss, it's not the right time to be working with a coach. You can do that later. If it's kind of long-term, sort of chronic, everybody had a dysfunctional family and that sort of stuff, you may do very, very, very well with a coach. But I think working with somebody that has the ethics and the integrity to tell you, I'm not the right person for you, if what your needs exceed their scope of practice, that would be something I would look for. And one of the bigger things is that coaching, even though there are a lot of efforts to regulate it, it is still an unregulated industry from government standards. So if you're really concerned about whether you're working with someone who has the right qualifications and you would want to take action if you felt that they harmed you in some way, you are able to do that if you're working with a licensed therapist. If you're working with a coach, we are still unfortunately in kind of a let the buyer beware situation. I know many great coaches and I know many mediocre therapists. So it really isn't so simple as just this or that. But I think if you're really concerned about how much training the person has, whether there's recourse if you are unsatisfied, you're probably better off with a therapist. And I should also say that with very few exceptions, coaching is not covered by your health insurance. So if you really need your health insurance to pick up most or part of the tab, you need to be working with a therapist. But you find an increasing number of therapists that offer coaching as well. And they may be able to do that under their therapy license.
Yeah, thank you for that, Diane. I'm so glad that you were able to take that. So Molly, I hope that helped answer your question. I mean, for the most part too, coaching is, as Diane had said, it is not regulated yet. However, most coaches who do this work tend to do it virtually and not necessarily in person. Whereas therapists, they can do either or. I think some of that just kind of depends. But a large majority of coaches are only virtual. So you're not necessarily limited to somebody in the Indianapolis area if you find the great fit. And I do want to call out too that your question really underscores what we were talking about earlier, that, it's not all about stimulants. And yes, stimulants are proven and effective as first line, but it's not the be all end all. And so I'm glad, Molly, that you're looking at additional ways to learn the skills, learn the coping mechanisms, and working with your mindset around living with ADHD. Yes.
Can I make a quick comment, because I forgot to mention it earlier?
Yes,
we
of course.
talked about stimulants, but many people don't know that there are medicines that are non-stimulants.
Yes.
That treat adult ADHD, and there are more coming in the pipeline. And there are also some substances that are not pharma. Like, for example, if your sleep cycle is shifted, using melatonin can be a helpful tool. So that's something that you can buy in a pharmacy. So there are other things that you can do in addition to the coaching and the therapy. But I love it when you can do a combo, like you said, hit it from more than one angle at a time. And the medicine is just a tool, like everything else. And whether it's the right tool at the right time, that's always the individual part. But I forgot to mention, I want to make sure people know that, because most people don't know that there are non-stimulants that do treat ADHD.
Yes. I also think that people don't realize that sometimes medication provides the scaffolding to be able to actually implement the skills, and that it doesn't mean you need the medication forever. You need the confidence to know you can do it. And I think that's something that we often don't talk about, and parents are afraid, if I start my child on this medicine, it's for life. And I honestly find that sometimes the younger we medicate, where they can build the confidence and build the skills and know, I got this, the less they need the medication. So I think that's an interesting thing to just throw out there.
Yeah, I will certainly say, as a behavioral pediatrician and doing the class that I do from 8 to 12 years old, I will often tell parents, especially if we start medication in 4, 5, 6, 7-year-olds, that there will be a time come 11, 12, 13, 14, that their child will say, I don't want to do it anymore.
Mm-hmm.
So part of my job is to get parents ready for that, because it will be inevitable. It will be something that happens. It's just part of life. But we do want to use every single moment along the way to help educate our kids so that they understand what's happening every time they come in to see a doctor, a therapist, a tutor, and be able to talk with their teacher and ask for help. So we want to build those skills and that awareness as early as possible, because it's not just the one thing. And of course, we have to honor what the person is saying. And even though the parent may be like, ooh, I don't know, I'm not sure, it will bring back flashbacks of before medicine. But honestly, if we want to have that child or teen to have buy-in, we have to be able to listen to what they're saying and give them a chance to experience what life is on versus off medication, so that they can eventually make that choice for themselves. Okay, I have another question here from Sarah Beth. Hello, Sarah Beth. I'm so glad that you're on. So, what are your favorite self-care tips for ADHD moms with ADHD kids struggling with caregiver burnout? Can I just say, this is a great question.
Yeah, great question. Self-care. So I would say back to the basics: sleep, exercise, nutrition, and joy. What do you enjoy, and what fills your cup? What makes you happy, right? And back to those basics. If you get enough sleep, if you focus on nutrition or meal planning, if you have exercise or time in nature, all of those things, again, it's like we forget that how important those essentials are. And I help my clients focus on those as core goals, because if we don't have those functioning, everything else feels almost impossible.
Yes. I think throwing out the judgment too. As a mom, I think we're always so afraid people are going to think we're not a good enough parent. And if your child doesn't have ADHD, it's going to be really hard, and you're going to judge my parenting, but you don't get my kid's brain. And so I have to be at peace with that, knowing that it's okay that you don't get that. It doesn't matter. I know, and I'm okay with that. And I know that my kid doesn't like to be bored, and they're busy, busy, busy. And you can think, why is your kid doing all these things? But that's what's best for mine. And it's okay that you don't get it.
I love that. A client told me recently that radical self-care for her was self-compassion. And I was like, yes, that's exactly acceptance, self-compassion, awareness of what we're doing and how we're doing it, but not with that judgment and criticism, the shame, the layers of self-doubt and shame that we've, worked ourselves into at this age.
Yes.
Yeah, that's radical self-care, loving yourself in that way. Just the mindset or how we think of ourselves or how we speak to ourselves.
Yeah.
I have two favorites. My first, and this is for all women because I think this is where the gender roles really kick in. Delegation is my top favorite one. Make a list of every single thing you have to do at your house and go through it. And do you need to do those things? Can somebody else do them? Can a kid do them? Can a partner do them? Can a neighbor do them? Literally, can you pay someone to do them? Can you barter someone to do it? Literally get half the things off that list. And then my number two, and I don't think we're allowed to cuss here, Dr. Narissa. If I was allowed to cuss, I would cuss. But there are things that can be half aid. Right? Like there are things in life that do not need to be 100%. And as a mom that proudly did not bring snacks hardly ever to any of the kid activities and got lots of stinky eyes, that's something that can be half aid. Like, I don't really care. That's really not important. They can go get a snack from their friend. So I think that the perfectionism and the gender roles here really come into play. The women with ADHD that I work with have a lot of gender role baggage on them. And if you have a partner that does not have ADHD, it can be a great delegation, actually, because sometimes the compliments, it just may go against gender norms. And so being comfortable switching up the gender norms. But those are my two favorites.
So I echo everything you said. Delegation is key. And giving yourself permission to delegate is also key because I don't know about you guys, but I hate doing the laundry and the dishes. And so, discovering that you can go and drop off your clothes at the laundromat and they give it to you back folded, and you just pay like $25 for 10 pounds and it's the best $40 you spend that week. Otherwise, it'd be 2 days of me doing the laundry because I forget and I got distracted. Then I didn't dry it, then it smells like mold, and you just go round and round in circles. Then you're using vinegar to get it out, and then your self-talk is like, how did I forget this? Like, I can do everything else, but I can't do the laundry. Or you finally did the laundry, but you never put it away, right? So I think giving yourself permission to do it your own way is key. And if you don't like doing a certain thing, like not making it mean anything, call your friend over that loves to organize, and you can call the pizza in and the wine, and that's okay. You can talk the whole way through it, right? Like a buddy double, and somebody that's not attached to your stuff, and like make it. Of course, it's really easy for me to go do it at her house, right? Because it's not my stuff. So like you swap, right? Like make it okay for go to her house for 3 hours. She comes to my house for 3 hours, and then you got to hang out with your cool friend, and you got some cleaning done. So I think allowing yourself to do it in a creative way. And part of the self-care is also realizing that maybe you do need date night, even if it's 2 hours like a week to nourish that relationship with your partner. Or maybe you just need to go out with your friends and be okay getting a babysitter, because the more that you pour onto yourself, the more that you then can show up refreshed for everybody else. So getting creative, dropping the kids off at the neighbor's house, and then they drop off their kids another day at your house so that they can have date night, you can have date night, and the kids are happy because they're getting entertained, and you're happy because, you trust somebody who's watching them, right? So I think it's giving yourself the permission to ask, even if it looks not the way other families would have done it, right? And asking, because if you never ask, it's always a no. But if you ask, you have a 50-50 chance, right, of it actually being a yes. So you're always ahead if you at least ask. And if it's a no, then you never know. They can come back at you and be like, well, not this week, but next week would be great. You just never know, right?
Yeah, that's a great reminder. Thank you. Thank you, Diana. So I do want to be cognizant of the time. We have about 10 minutes left. So again, if you're watching and this interview conversation is bringing up issues or questions, or you just want to, agree with something that someone said or share a different opinion, please go ahead and put that in the chat box and we'll take a look at that. I would really love to hear from all of you guys in terms of, in this day and age, doing what you do, what is maybe the one thing related to ADHD and women that you feel needs to be said today? I mean, I know that we talked about how ADHD, the label itself is terrible. There's a lot of stigma. Medications are there. We talked a lot about coaching and therapy and doing a comprehensive assessment. What do you find is still kind of your banner, or what is that you want people to know when it comes to this topic? That's a big one.
I'll start. You are not lazy, crazy, or stupid. You don't just lack willpower or self-discipline. You are not a failure at life or motherhood or relationships. You have ADHD and you have an executive function challenge, and you're not alone. There's a community of support and people that are like you, and we're all struggling at something, and we can ask for help. It's okay to ask for help.
Yes. And find your people. Find the people who love those qualities in you. Find the people that bring out the passion that drives you. Because I know when my ADHD brain likes something, I love it. And I can find every avenue and, just sometimes I amaze myself, which is odd because I grew up not thinking I was very amazing. But when you find what you love, you're surprised at what you can do. And so find people who support that. And if they don't, they might not be your people. If you walk away and go, I don't feel very good, it's just a sign maybe you should go somewhere else.
To that point, one of my favorite t-shirts, and probably the one I wear the most often, says, "You're too much for some people. They're not your people."
Yes.
And I always have other women comment on that. I'm like, are you one of us? And I would say that not everybody was born to fit in. Some of us were born to stand out. And if we can accept that and not try so hard to see where we fit in, because it's not the same as belonging. Fitting in means you have to, squeeze and shrink and be less than you actually are. So the more you can just embrace the fact, actually, I wasn't born to fit in, I was born to stand out, and really practice thinking that, you will be able to find the thing that makes you most special. And you will have a lot less trouble learning to accept and love yourself than many of us have experienced.
I love that.
Yeah. Oh, I got goosebumps when you said
Yeah.
Love it. Love it.
I think that ADHD is a gift that you just have to learn to unwrap. And in unwrapping it, again, it's not about getting it perfect. It's who you're becoming along the way, right? And you might never arrive at the destination, but that was not the whole point of this, because most of us think that arriving at the destination was what gives us the joy, but it's not. It's who we're becoming as we're arriving. And again, you never need to arrive. You just have to make sure you have the good friends around you to make the journey fun. And in asking for help, nothing is too heavy if you share the load with everybody else. And so I think realizing that we are only as happy as we allow ourselves to be, it's a start of something, right? Because you might think this is the best it's going to be, but what if that's just like your 2% and you could have the capacity for a lot more if you allowed yourself to? And realizing that emotional regulation, it is an executive function. And while it's not something that is used in the US to label it as ADHD, it is used in the UK. So in the other side of the world, they use it. So I'm sure eventually when this gets updated on this side of the world, like it's going to be a lot more obvious. But the point is that emotional regulation comes with strategies. And so that's what I'm trying to get at, that we all can continue to acquire strategies, not because we're broken, but because we're trying to, again, set up systems that support us, that helps us thrive, not just survive, but thrive in how we want to create a life. Um, and so for ADHD, I want you to, if you do have it, learn to identify it so that you can label it, so that you can laugh at yourself instead of calling it a character flaw and, oh my God, I'm broken. You can say, there's my ADHD and laugh about it instead of internalizing it. Um, you know, every day I see it come up and I just have to laugh about it and go about my day and keep telling myself, you're doing great. Keep going. You're doing great.
I guess
I
I just
love
throw a final kind of thought would be just from maybe more of like a medical viewpoint that, you know, women's bodies change frequently. And so a lot of women, if you're listening and like thinking, oh, well, I didn't need help before, why should I go now? Or, oh, I was on this dose of medicine for 10 years, why should I change it? Or, oh, you know, kind of a lot of that self-questioning. You know, we're always changing. And I find that working with women with ADHD, the more that they gain the strategies to understand where the ADHD is impacting them at that stage of their life, I really have seen a lot of, you know, anxiety kind of melt away, or depression melt away, or substance, like things just kind of get easier. And so we are changing, our bodies are changing a lot. And so, you know, every 5 to 10 years, you need to kind of take a look and reassess. And so if you embrace that, like you were saying, maybe Dr. Diana, the journey, it is a journey, embracing the stages. What worked for you 10 years ago may not work for you now, maybe won't work for you in 10 years, but that's okay. That's just life. Life is going to change. So if you're hesitating to get help or to make a change or to reassess, like that's just part of the journey, and that's normal. And that's just the way our bodies are. And women's bodies, probably more than men, tend to go through a lot more frequent changes.
Yeah. And I will say, you know, for all of, on behalf of all of us, I really think that this conversation is one way to just get awareness out about this. I think hopefully those of you who are watching or are going to watch on replay, sharing it with friends or family who you think would benefit. I would really appreciate you helping spread the word, because if you think you yourself may have ADHD, listen to that. Go find someone who you can get a comprehensive workup about, you know, and if you do get the diagnosis of ADHD, I hope that you're inspired today, that there is hope, there are treatments, there are ways to figure out how to work with that brain, and to really embrace it rather than thinking, again, like you said, Diana, it's a character flaw. Because there are so many things that many people with ADHD can do. We're out of the box thinkers, we're creative, we're, you know, meant to stand out, as Diane said, you know. So there are times that life can be hard, but with the right team around you, education and self-compassion that you can nurture for yourself, you can learn to thrive. So thank you, everybody. It was such a great conversation. I want to keep us at time. But again, please share this live cast with other people. And we look forward to talking with you again real soon. Thanks again and have a good night.